Maybe I'll vote to change the rules on the committee. Oh, shucks. I was about ready to change the rules on the committee and say, the chairman got to vote on everything. For those that don't know, I think we have some medical students and residents. This is the time of year when committees are meeting on each other, on top of each other. So getting, a quorum. This is one of the larger committees. And so our quorum is 11. Sometimes the smaller ones, they only need 4 or 5. And even that is a small quorum. Probably should be a little higher with the number of people that are on the committee, but we probably never get them. Most of the time, it will end up with 20. Most of the time for meetings, we would end up with 20 people or so here, but it just takes time for them to come in, usually. Okay. 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 Okay, we now have a quorum. All right, everybody will turn their cell phones off, including mine. Okay, we'll get and call this meeting to order, the Health and Human Services Committee. All right, let's see who we're going to start with. I think where's Senator Burke is here, but Senator Kirkpatrick, let's let you go first, since I think yours is short and sweet. And that is Senate Bill 342. Everyone. And you're working off which
LC 520067S. Is that what you have?
That's what I've got. LC 520104S. No, wrong one. That's the wrong one.
Hang on.
That's the wrong bill. Okay, we got them. Hang on. Is it not in here? Have you got it? Somehow it didn't get in my packet.
67. Yeah.
Okay. All right, so we're working off 340, Bill 342, LC 520067, SCS. Is that all right? Everybody got it? Okay, go ahead, Dr. Kirkpatrick.
Yes, ma'am. Thank you. I don't have to tell y'all that mental health and substance use disorder are getting a lot of attention this year. Our state's already had challenges in this area, and the pandemic's just made everything worse. There's federal law that requires that mental health services are reimbursed in the same way as medical and surgical services. But this bill creates a reporting method for insurance companies in our state to submit information to our insurance commissioner's office. The bill allows consumers to have access to information that they need in making decisions about their health care. The commissioner will create a form for information required, and the insurance company, subject to the jurisdiction of the commissioner's office, will submit the information for their 5 largest plans by plan type to the commissioner, who will create an annual summary report by carrier. This information will be posted on the commissioner's website in a readable form that will allow consumers to compare the information between carriers. The insurers will post summary information about their coverage criteria on their websites. This bill gives our insurance commissioner the tools that are needed to be sure that insurers in our state are following federal requirements on mental health parity, and also adds transparency for consumers. I worked with various stakeholders on this issue and was able to get agreement that this bill provides a good framework for reporting mental health parity. And I appreciate the cooperation of Commissioner King's office, as well as representatives of the insurance industry.
Questions for the senator? Go ahead. Punch your button. Okay, Senator Hogan. Representative Hogan.
Tom.
Oh, okay. Hold on a minute. Who's number 2? Hutchinson, Representative Hutchinson.
Thank you, Mr. Chair. I just wanted to make a comment, and this is about what we're talking about here. The CMOs that kind of hang out at the defects office, and they don't tell them these are your benefits. They say, I'm going to give you a stroller or a baby shower or something along those lines, but they never talk benefits. So they lure them in with like a stroller, and then they're stuck with kind of crappy benefits. Am I the only one who's ever heard that? So you can, so somebody in the audience, I know I'm not the only crazy one. So they'll offer you a stroller, a baby shower, XYZ, but none of this information is there to compare benefits. So they're making the decision based on what they get at the time they sign up versus the benefits.
This is a reporting bill.
I know, I'm just putting that out there as a start of a conversation for later. Since we're talking about comparing benefits, if all you're making your decision on is a stroller, this may not even matter.
Okay. Would you like to respond to that, Senator?
Are you talking about commercial carriers? Because that's what this bill is limited to.
Oh, I thought this was putting the benefits in writing so that you can put it.
This is about mental health and the parity law.
Senate Bill 342.
Okay, I must be reading the wrong thing. Yeah, the Parity Act classifications to make sure that all the benefits that's listed. I assume that was on 49.
Line 49.
I read it as these things were going out to the public. All the benefits that have to be in writing.
These are things that have to be reported to the
Yeah.
commissioner's office.
Okay, so this does not go out to the information doesn't go out to the public.
The commissioner collects the information and then does a summary report that is published on their website by carrier. And the reason for that is because the raw data is meaningless to consumers.
Right.
And so we're looking for a way for the commissioner to provide that information to the consumers in a way that they can actually make sense out of it.
So I don't think the consumer, I'm agreeing with you. I don't think the consumer has enough information, but if this information is just commercial and it's not getting to the consumer, because that's my concern, is that they're making decisions based on what they get when they sign up versus what the ongoing benefits are.
Representative Hutchins, are you talking, this would apply to any kind of insurance?
I was talking about the CMOs,
Pardon?
the CMOs,
Uh-huh.
the Medicaid providers. When they go at the DFACS office, they have flyers, and they have representatives that offer them strollers, baby showers, diapers, free Tylenol, things of those. So they never get this information. The consumer's not getting this information, at least not for the CMOs, not at the DFACS offices.
Okay,
So this, if I may,
sure.
this is applying only to the commercial insurers, not to DCH. There's a separate bill about that
Okay.
that's working its way through the process.
Okay, all right.
Thank you.
Okay. Okay, thank you for bringing it up. I was going to say that we needed to do that, I think separately. I think that probably, is a significant problem that we need to look at so that it is explained to them more clearly. And it's not just about what gift you're giving. That's a
Right.
good point to bring up. Okay, other questions? Representative Mathiak.
Thank you, Madam Chair. Senator Kirkpatrick, can we talk about the dates that are on here? Line 43, when maybe that is not specific, but January 22. I don't know if can you help me with that?
That's the federal code section. And we were just trying to nail it down to what the federal rules are as of that date.
Thank you. Thank you. Thank you.
We got anybody else? Other questions? Okay, Senator, just to make this clear, this is a reporting bill. It has nothing to do as we move forward about requiring parity or not requiring parity.
It's strictly a reporting bill.
Strictly a reporting bill. So so that issue, we've already, moved a bill over across to the Senate that requires parity with mental illness and other health issues. And so I just want to make it clear. Okay, so any other questions? Is anybody in the audience, have you signed up to speak on the bill or want to speak on the bill? Okay. We don't have anybody. All right. So we can move forward. Representative Hogan, at this time, I've got a motion to pass. Do I have a second? Okay, I've got a second. Any further discussion on Senate Bill 342? All right, everyone in the favor of the passage of Senate Bill 342, say aye.
Aye.
Anyone opposed? No. Okay, the ayes have it. Thank you. Senator
Madam
Mullis,
Chair.
before you get up, is it all right if I move to one of the other senators that needs to go to health? Are you free, sir? Okay, thank you. Thank you. Okay, Senator Burke. Where's the other one? Senator Burke, here we got them, got them both. How about Senate Bill 338? And we'll be working off LC 338975. Is that correct?
That's correct. Madam Chair, thank you.
Everybody ready?
You ready? Everybody got it? Okay.
Thank you. I appreciate your invitation and especially appreciate you letting me go ahead of the Chairman Mullis. That's an honor. Both sides of this building have worked really hard over the last several years trying to get at the maternal mortality issue that has troubled our state. And I know this committee has done a lot of great work in this area, and I want to honor that work. This is a very, very simple bill. The governor graciously funded 1 year worth of postpartum funding for Medicaid coverage for pregnant women. It's the #1 recommendation of the Maternal Mortality Committee that's working really hard to get to the bottom of this issue in Georgia and try to make a difference and improve our standing. And so I want to thank the governor's office for their financial support. And I just feel like it's important to put this into code that issue is kind of put to bed. So I would appreciate support and be glad to answer questions. I know Department of Public Health that monitors and helps support the Maternal Mortality Commission is here if there's technical questions.
Questions for the senator? Okay. No questions from the senator? Okay, we do have people that want to speak on the bill. Ms. Marston.
Is it okay if I sit down?
If you what?
If I have a seat?
Oh, sure.
Okay.
Like that. I mean, well, you'll need to do it at the table with the mic. I'm sure. And if you will give us your name and again, and if you're with somebody or you're here on your own or whatever. Welcome.
Thank you. Thank you, Chairwoman Cooper and committee members. My name is Tina Marie Marsden. As a patient advocate, I'm also a member of the Metro Atlanta American Heart Association advocacy team. At the age of 28 and 4 months after the birth of my second son, I was diagnosed with postpartum cardiomyopathy, also known as PPCM. Early warning signs during and after pregnancy were missed in my case. Pregnancy-related complications, including high blood pressure, blood clots, cardiovascular disease, stroke, and other heart problems like cardiomyopathy may not surface until weeks or months after delivery. I did eventually need a mechanical heart pump or LVAD just to sustain life. Health problems during pregnancy and postpartum impose a significant economic burden on families, communities, and the health system. Extending Medicaid coverage could potentially mitigate part of this burden by ensuring moms can prevent or treat health issues before becoming progressively worse. I recently celebrated 10 years with my mechanical heart pump, which clearly shows that a maternal health crisis can have a lifelong impact. For those unfamiliar, it's an LVAD. So I have this connected to me 24/7. I've carried this around for 10 years as a result of my own maternal health crisis. Today, many women continue to face dangers, including death due to misdiagnosed and untreated pregnancy-related conditions. About 1 in 5 uninsured new moms reported at least one unmet need for medical care because of cost. And over half were very worried about paying their medical bills. As a patient advocate, not only have I lost friends to maternal mortality, I have met mothers throughout this state from Smyrna, Atlanta, Decatur, Fairburn, Griffin, Waycross, and beyond, who each developed postpartum cardiomyopathy. Reports stated nearly 70% of women describe at least one physical problem in the first year postpartum period. Nearly a third of all pregnancy-related deaths occur 42 and 365 days postpartum, with the number of maternal deaths attributed to cardiovascular disease being highest during this period as well. That distinctly demonstrates the urgent need for postpartum Medicaid expansion. Access to healthcare is vital for early diagnosis and treatment of pregnancy-related medical conditions, which is necessary to effectively address the maternal mortality rate. I ask for your support of House Bill or Senate Bill 338. Thank you.
very much. I think you came from Griffin.
I did.
Thank you so much for coming. And I know that's a burden carrying your mechanical heart around with you. But I tell you, this committee has worked on a lot of issues. And Dr. Burke and I have both worked on getting the Medicare expansion and the money to go with it in the budget. In fact, NCSL, which is a magazine for legislators that goes across the country, I just sent them a quote on why it was so needed. And I'm being very positive that it's going to pass the House when it passes out of this committee. So,
Perfect.
but your testimony is really important
Thank you.
because it puts a face
Yes.
for us on what really happens from the stress of pregnancy and in the postpartum period. So
Yes.
thank you very much
Well, thank you.
for coming. Bethany Shera.
Hi, I'm Bethany Scher with the Medical Association of Georgia. I'll be brief. We just want to stand in support of this bill. I will also mention while I'm up here that we support SB 496 as well. This is a very important issue to our membership, tackling the issues surrounding maternal mortality and ensuring that postpartum women and have access to the care that they need and that we have the data we need in order to tackle those issues. So we really appreciate this committee and Dr. Burke and the entire legislature's work on these really important issues, including Governor Kemp. Thank you.
Were there any questions for Bethany Shera? Okay, Dr. Elizabeth Mosley by Zoom.
Yes, ma'am. Thank you very much. Is everyone able to hear me okay? Just a thumbs up, perhaps. Thank you so much. So my name is Dr. Elizabeth Mosley. I'm a public health researcher and a doula, which means that I assist people during pregnancy, childbirth, and in the months after their birth. And I fully support Senate Bill 338, which would extend the access to Medicaid during pregnancy and until 1 year after pregnancy ends. Currently, as you know, Medicaid in Georgia covers up to 6 months after pregnancy, but 32% of maternal deaths in our state occur later than that. And as a doula, I know that my clients are being carefully monitored before and during their childbirth. So my job is really to help them advocate with their doctors and their nurses for what they need. But after delivery, women are basically on their own. And after being seen for their 6-week follow-up, many women lose connection to the health system entirely, potentially exacerbating their chronic and their pregnancy-related conditions, as you've just heard. And this can lead to maternal morbidity and mortality. Many of these health conditions happen after childbirth, and the underlying health issues get exacerbated by the stress of pregnancy on the body. So having access to insurance and medical care before, during, and after pregnancy can prevent many of these deaths. I want to leave you with a personal story from my own personal life. One of my dear classmates from Savannah was pregnant. She's a Black woman. As we know, Black women are 3 times more likely to be affected by maternal mortality in our state. And my friend struggled with mental health and suicidality during her pregnancy and even attempted suicide shortly before she gave birth. She was admitted to Clark Center at Memorial Hospital under close supervision, but then after she delivered her child, she wasn't given any medical support and she was discharged home. She had severe postpartum depression. She drowned her son in their bathtub. She was arrested and she faced prison for murdering her child, even though this was postpartum depression and psychosis. And we know that mental health issues like that are more likely to cause maternal mortality in the postpartum period after 6 months than any other time during kind of the years surrounding pregnancy. So my plea to you today as a public health professional and as someone who grew up in Georgia and saw this happen to my own friend, I'm just asking that you please extend Medicaid to at least 1 year postpartum to really help us uplift the lives and well-being of women and children here in Georgia. Thank you so much for your time and for considering.
Thank you very much. I noticed and I missed the first part and I apologize for that. Are you an MD, an MPH? It had Dr. Elizabeth Mosley on this?
Thank you. I'm a PhD MPH. So my PhD is in public health and demography, and my master's is in public health.
Okay, and you're a doula.
That's correct. Yes, ma'am.
Okay, thank you very much.
Thank
Okay,
you.
I have a Dr. Sidney Germont. Oh, there we go. If you'll tell us who you're with and
Hi, so I'm representing myself. Good
Okay.
afternoon. My name is Dr. Germont, and I'm an internal medicine physician, and I have a Master of Public Health specializing in reproductive health. And I'm speaking here today to encourage you to pass Senate Bill 338 to extend postpartum Medicaid coverage to Georgians to 12 months. Enacting this policy is one of many essential legislative actions required to address Georgia's maternal mortality and morbidity crisis. Much attention has been paid to the fact that Georgia has one of the worst maternal mortality ratios in the United States, more than twice the national average. For every 100,000 births, 66 people die during pregnancy, childbirth, or in the following year. This crisis forces low-income communities, people in rural Georgia, and Black birthing people to shoulder a disproportionate burden. Birthing people living in low poverty are twice as likely to die from pregnancy-related complications compared to those who have a higher income. Black birthing people in Georgia are 3.3 times more likely to die than white birthing people. Georgia's health experts believe that more than half of confirmed pregnancy-related deaths in the state are preventable. From 2012 to 2014, the leading causes of pregnancy-related deaths were either strain on the cardiovascular system, like heart failure, and you had the patient advocate have a just powerful story about that, and or other health complications created by pregnancy, like eclampsia, which involves high blood pressure and seizures. So many of these deaths could have been prevented with access to insurance and medical care before, during, and after pregnancy. Furthermore, it's necessary to extend postpartum Medicaid to 1 year because of the latest report from Georgia's state-mandated Maternal Mortality Review Committee, which said that 82% of maternal deaths occurred in the postpartum period up to 1 year. 32% of maternal deaths in Georgia occur later than 6 months after pregnancy ends. Moreover, since Georgia legislators are prioritizing mental health during this legislative session, it's important to highlight that 16% of pregnancy-related deaths between 6 months and 1 year postpartum are because of mental health issues like death by suicide. We know 1 year of coverage postpartum will save lives, and it's vital to pass Senate Bill 338. In conclusion, Georgia legislators have made great strides in improving maternal health. Since 47% of Georgian births are financed by Medicaid, extending postpartum Medicaid coverage from 60 days to 6 months in 2021 was crucial to creating the opportunity for people to achieve their optimum standard of maternal health. I encourage you all to continue that momentum. Moreover, while extending Medicaid coverage to 1 year postpartum is critical, it is one piece of the comprehensive legislative action needed to guarantee maternal health equity in Georgia. I appreciate the opportunity to discuss how Senate Bill 338 will improve the health of Georgians and help Georgia become a safer place to give birth. Please vote yes on Senate Bill 338.
Is there questions for Dr. Germont? No, I don't hear any. I will say thank you for saying that we have improved our maternal mortality rates. And I do, since we have students here, want to tell you that that has, Georgia has been rated very low, near the bottom, but there has been some faulty information that has gone out about our maternal mortality deaths. We had a big study committee. We are a state, we compare apples and oranges across the states. Some states report, and only for a short period postpartum, we report deaths up to a year. So you have some states only doing it for, a couple of months postpartum, and then there are states like we do that go up to a year. In the past, I haven't seen the latest review that they were doing, but for 12, 13, and 14, what happens is the death certificates go to the CDC and they come up with a number. And the number for those 3 years was 205 maternal deaths. When they sent out the nurse extractors, nurses that go out and totally paint a picture of everything that happened to that mother for that year, that all during the pregnancy, if they saw a doctor, they get the physician's notes in the hospital, if it was a car accident, how they died and everything. And they put together a picture for the commission. That number went down to 101 from 205, something that was not considered or reevaluated on our standing as far as our deaths. Now, as far as I'm concerned, one maternal mortality death is too many, but I'm also a Georgian. I'm Georgian by marriage, a Texan by birth, but I'm proud of my state. we have done a lot of work on this issue. And, one thing that encourages people to do more is when they do get credit for what they've done instead of always been beaten down. So I will bring that up, that there's a difference, and we're working very hard. But as I have said, one maternal mortality death is too many. Okay, I think that takes care of everybody. And Dr. Germont, thank you very much for taking time away from my practice. I take it you're in internal medicine. Thank you for taking the time. And for the students, it's very important that you stay active in your medical association. Pay attention when they send out emails for you to contact your legislator. Be willing to come down and testify when we need somebody to testify. I mean, I'm a nurse. I can sit up here and tell my members what I think about it, but I'm not an OB nurse and I'm not a physician. And that information and being able to answer specific questions they have, it is extremely important. And so I hope as you go forward, and your host today did not pay me to make that commercial about belonging and staying involved. It is just vitally important that you do so. Sorry, Senator, Dr. Burke, I really appreciate you letting me taking the time. Okay, so we are at what would the committee like on this? Okay, Representative Bennett. Okay, I have a move to do pass. Do I have a second? We've got a second. Any other discussion about the House bill, Senate Bill 338? No other discussion. And so everybody in favor of House Bill 338, say aye. Aye. Anyone opposed? No. Okay, the ayes have it. Okay, Dr. Burke, let's move to Senate Bill 496.
Thank you, Chair. This is a similar vein. The number 2 recommendation from the committee that has been doing the work that you mentioned and documenting the causes of death. Their concern was there were so many deaths that occurred that there was not a cause of death available. So Senate Bill 496 contemplates setting up a system that would be somewhat like the forensic autopsy system that's already in place, where if there's a suspicious death, a coroner's case is developed and the medical examiner gets involved. The only difference with this process is instead of the medical examiner getting the body, the medical examiner's inquiry will be done, and then they will direct the body to the regional perinatal center for the autopsy. And I appreciate a news story about this bill when it came out of the Senate, but it did say that all maternal deaths will be autopsied, and the purpose of this is to try to autopsy the maternal deaths when the cause of death is unknown. Now, many of those deaths occur under care, and the cause of death is understood by the physician and the medical team. And so again, I want it to be clear, we're not autopsying anyone who doesn't have an unknown cause of death. We are attempting to get some money in the budget for DPH to develop a grant program for these perinatal centers so that they won't be out of pocket for these autopsies. And I hope to see that coming out of the Senate in our budget that's coming soon. That's not a promise. My appropriations chair is Senator Hill and under Senator Tillery subsequently, who they've always said, don't make a promise about the budget because you're not the one there at the last minute. So again, that's just my hope that we'll get this funded. And I'll be glad to stand for any questions if there are any of the committee.
Questions for the senator? Well, I can think of one, Senator. The loss of a mother is very traumatic. And as you study this and it went through the Senate, was there any discussion about how the family might feel that, after this death that we're requiring an autopsy?
Well, I certainly had that discussion with the members of the perinatal teams, the physicians that are there when these things happen, and they felt like that, although that was a valid concern, that the issue of autopsying when crimes are committed, because that is the standard, they don't get much pushback in the medical examiner's world. And I think once we educate the public, the reason for this from the standpoint of trying to save lives, that won't be a significant problem. But I think it is realistic that it will come up, and I think it will require some education and make sure people understand the why.
Okay. Representative Hutchinson.
Thank you, Mrs. Chair. So if I understand this right, we're asking for autopsies for pregnant women.
And postpartum.
Yes. Why just pregnant women or in postpartum?
Well, the purpose of this bill is to get at the problem of maternal deaths. And so
Okay.
that this is specifically narrowly tailored to women that die either during childbirth, pregnancy, or during that 1 year postpartum. And again, it's not when they die, it's when they die of undetermined cause.
Okay. And is there a fiscal note?
There's not a formal fiscal note. The perinatal DPH folks have said that they expect this to be less than 50 autopsies, and we're talking about somewhere between 1,000 and 2,000 per autopsy. So it's a minimal cost to the state for the amount of information we would gather from it.
I was going to say that the chairman has the discretion about one when the amount is not considered significant. I mean, $50,000 is in the state budget. Sounds terrible to say it's not a significant numbers. 50. Way more than that.
Well, we only had, in the latest statistics, we only had 68 per 100,000 last year. I mean, again, we're talking probably 100 last several years, but not every death will need an autopsy.
Right,
It's
out of that
probably less than 30% of them will need one. So
So is that 66?
that's per 100,000.
Oh, per 100. Okay.
Yeah.
But
this is the latest info. You mentioned the numbers from 2014. This is 2015 to 17 that public health has. They are supposedly catching up and will have up-to-date numbers sometime this year.
Okay,
so
good.
I'm excited to
Finally.
hear where we are.
I
So,
know that we gave them 2 more nurse extractors.
that's right.
That's what they call them, so that they could try to catch up and get the information to the committee. That was a couple of years ago.
Yeah, and I do want to mention, if I may, the lady that testified about the cardiomyopathy. We also have a budget item to develop a pilot for specific evaluation of high-risk ladies in a couple of our higher risk areas of the state to have more echocardiograms done with a lower level of concern than has been done in the past, to try to see if we can get to that problem, because it is one of the most common causes of maternal deaths is cardiomyopathy. And a lot of those are being undiagnosed until you have a severe event, and then it's too late.
Is that the study going to start prenatal, or is it just?
Yes, it would be prenatal
Prenatal to
and
pick it-
postpartum both
and
would be
postpartum
eligible.
both to pick
Yes,
up
yes.
on the
And again,
information.
the perinatal folks are working with me on that, and I want to thank them for their work. So, and the bills that we've done and grants we put in place for maternal hemorrhage and so forth, that those have been going on now for 3 or 4 years.
Right.
And the numbers that we're seeing in reductions in those problems is significant. So again, I appreciate what you said. Have done a lot of work in the last 4 or 5 years on this issue. And I think we'll see the fruit of that, in the next few years
Right.
as the data comes out.
Especially on the hemorrhage and the bundles, then getting
That's
them
right.
to our
Mhm.
hospitals where most of our deliveries. It's
That's
still a
right.
little problem with rural hospitals where they might have 1 or 2 deliveries a month or even less than that, and don't have the staff to, designate a couple of people that are always trained for that, I think, but they're working on it. So that group has done a really good job of doing that. Representative Newton.
Thank you, Chair Lady. And I appreciate you attempting to bring and planning to bring real data to something. I know the Chair Lady and I had the study committee a couple of years ago, and it's tough when the numbers are fairly small. And then on top of that, you're not sure which category. You did mention something about you expect only maybe 30% that you think would require an autopsy. Is that because if it's a known?
That's right. Because if it's a known one, they won't need an autopsy.
Where is that in the bill, or is there somewhere in here that it excludes those?
When it's, the language that says when it's unattended, and basically that means if you have an attending that's seen the physician and is allowed to tell the coroner that I'm signing this death occurred because of what on the death certificate, then that would be the process for that. To occur.
When unintended by a physician goes with number 10 up in line 25. Is that an and?
Yes.
Or okay, so it's on. Okay, so I guess I'm reading it more like it might have been an and there with the when unattended by a physician. But I appreciate you doing that. I think it's a tremendous thing. And then on the autopsies, I'm not a pathologist. I don't know if there is one. Is there just a one size fits all full autopsy, or is it an autopsy until they get to a cause of death?
Well, the autopsies that will be done in a perinatal center obviously would be a different autopsy than a forensic autopsy that the medical examiner would do. And you're right, they would evaluate for known causes of death in someone related to pregnancy, and would be up to the pathologist's discretion to what their actual procedure would be.
So the families could be reassured that it was only enough to get a definite answer on
That's right.
pulmonary embolism.
And we've talked with the perinatal folks, the people that this affects, and they're very comfortable that the regional perinatal centers have the expertise and the knowledge on these kind of medical issues to do a good job, so that we get the kind of data that we're looking for these folks.
Thank you very much. Great.
Where was let me ask our attorney, where were you questioning it should have been and which line?
Well, I'm not legislative counsel. I guess when I'm looking at number 10, which is the new language.
Okay. Excuse me, can I get our counsel to look at, now you're looking at.
Really
number
lines
10?
25 through 28.
25 through 28.
Now, previous number 10 before this bill, an unattended by a physician, it was considered, but I guess, are we saying only pregnant females or 365?
That clarifies it. Okay, go ahead.
So if you don't mind, if you know they died of a hypertensive crisis or eclampsia, they would not necessarily have an autopsy
That's
required.
Right. That's right.
Right.
And talking to the medical examiner, that's what they do every day. And even in the forensic world, it's their decision who gets an autopsy or not, based on the clinical data that they review at the time that coroner's case is developed.
Thank you. Yeah, I see on line 45, shall order a medical examiner's inquiry.
That's right.
But
And-
that
and
does
that
not
inqu-
mean
the
your mother
inquiry-
or your wife or your whoever daughter is necessarily having a
No.
full. Thank you.
Yeah, that's right.
Yeah.
Thank you for clarification.
Thank you very much, Attorney. Okay, everything, I see no further questions. Is there anybody at the audience that wants to speak to this bill? Okay, no. All right, what's the committee's? We have a motion to do pass and I have a second. Got a second? Any further discussion? No, then on Senate Bill 496, everyone in favor say aye. Opposed, no. Ayes have it. Thank you very much, Senator Burke. I appreciate it.
Thank you.
Okay, now we have our esteemed rules chairman. Sorry you had to wait a while. Took my committee a little time to get here. So. And I appreciate the committee members coming in, even though they're late. I understand there was a Ways and Means Committee. So this is Senate Bill 345, LC 52-0104S. Is everybody working off that? Okay. Our
Thank you.
esteemed rules chairman from the Senate, thank you very much.
Thank
And
you,
my
Madam
friend,
Chair,
Senator
and-
Mullis.
And as you know, that I will not be returning this year, and I just wanted to show you something. This is the first thing that Representative Cooper gave me, a $2 bill when I first got elected. It's supposed to be good luck, and it has been because I've been able to meet all of you. But
Oh, yeah.
do pass, thank you. But she gave me this 22 years ago. And it has brought me great success. So thank you, Madam Chair.
And if I had time, I could go to my pocketbook and pull out a matching one. So,
Sorry for that.
no,
Personal
that's fine.
disclosure.
In fact, just so, before he was Senator Mullis, he was Representative Mullis and served with us in the House. And, we can jokingly say we didn't you?
No, I didn't.
No, you didn't?
But I wished
did I
I
miss
did.
that?
It was been such a joy.
What was I doing helping you then?
Well, because you saw great potential.
Potential.
Yeah, yeah,
in you. Golly,
But if it'll help me, I'll say I was in the house.
No, that's all right.
Because I wish I was. You have so much fun in the house. We're a bunch of
It's
stiff
much
shirts,
more
you know?
interesting than over in the Senate, I can tell you. You could just ask all of us that just got out of a caucus
And let
meeting.
me tell you, I'm somewhat saddened too, because Representative Hogan's bill's on the floor tomorrow, and I won't be able to see him in my office every day again.
Oh.
So he knows how to get a bill on the floor, I'll tell you. Yeah, you're very
Okay.
kind. Okay, look, this is very simply explained. I know it's, there's some people not for it, I get it. But this simply says that the state of Georgia government can't mandate a COVID-19 vaccination. Now, we've excluded the medical side in the state of Georgia government. And let's say that you're going abroad, perhaps, you might be dictated to get a vaccination if they require it wherever you're going. But this bill just simply says the state of Georgia can't mandate it, a COVID-19 vaccination. Now, I had COVID in 2020 around Christmas, perfect time, actually, couldn't go anywhere anyway. And I've had 2 vaccinations and I had my booster this fall. So I believe everybody should have a shot. I just don't think the state of Georgia should mandate it. That's all this bill does. And it has a 1-year sunset. So we can reevaluate if we need to, or something happens, because my whole premise is, this is a new disease. And what's it going to look like 20 years when we look back? Did we do the right thing? Did we not do the right thing? Should we handle it different? We don't know. The other vaccinations, some have been great, like polio and whooping cough and measles and all that stuff. But they've been some that didn't work out along the way. So that's what this bill does. It just simply says if state of Georgia cannot mandate COVID-19 vaccination. Be glad to answer any questions.
You have some. Representative Hutchinson.
I have several, so you're just gonna have to tell me when to stop.
2, and then we'll
Okay.
go on.
You said that when we look back in history 20 years from now, the COVID passport, you think we're gonna be thinking about?
Well, same thing. I mean, requiring a vaccination is requiring a passport, not requiring it doesn't require the passport.
Because I'm just thinking, let's say my child unfortunately dies from this. 20 years from now, I'm not going to say that darn Georgia, I'm glad they didn't require passports.
Well, that'd be a rare occurrence.
It's not rare. 1 million people in this country have died. My problem with this.
Huh?
This is
Okay.
continuing my second question. We're already talking about another strain of COVID, correct?
I'm not sure.
Which is foodborne, I think I read. So let's say that next month, everybody has COVID or it's spreading, a different version is spreading. We are telling the state we can't even require, I mean, that a requirement of a passport could stem the possibility of it spreading even more,
Well, you and I, Representative, just disagree on this issue.
clearly.
Yeah. I mean, there's my passport.
No, and this will be my last one. My kids are in school overseas. They have a passport. It's required. Their numbers are way, way less than ours. I am thrilled that they are over there and requiring a passport because it's not nearly as many people died where they were. So I think this is counterproductive for public health.
Well,
And
and let me just say that it doesn't say you can't get a passport or a COVID vaccination. This just says the state of Georgia can't mandate it. That's
why?
all.
I'm sorry.
We just think differently.
Representative Hutchinson, we need to move on, get questions. That was 3, I think, not 2. Okay. Representative Chokas.
Appropriate time, ma'am.
Not the appropriate time. Representative Hogan.
I'd like to second the
Oh.
appropriate time.
Okay. Representative Bennett.
Thank you, Madam Chair, and thank you for your service
Thank you.
and best wishes on your
Thank you. very
next
much.
season. Question, you mentioned, and I want to understand what you said. What
Yes,
does it
ma'am.
mean that you have excluded the medical side? What does that
Well,
mean?
in the Senate Health and Human Services Committee, they wanted to make sure that because medically you're dealing with it all the time, you're in front of it all the time. And if they have a different policy, we'll allow that to go through.
Madam Chair, second question. One more, I won't go 3. This, when you say you don't mandate it, however, would municipalities, school districts, political subdivisions, counties, should they decide that they would like to have it, would they have the local control authority to do so?
No, ma'am, not unless they're medically related.
Thank you.
Representative Sharper.
Thank you. Just a couple questions right here. Can you go in detail when you're meaning public corporations specifically in this bill? Line
Well,
14 to 15,
well,
public corporations.
This doesn't mandate for the public sector or the private sector. Public, we're talking about, again, just the state of Georgia can't mandate it or subdivisions of the fact.
Okay. And right here on 31, where you're saying private entity, can you go a little bit more into detail? I just see that in lines 31 and 34.
Sure. And I know that there are a few people that want to make sure that private entity can't mandate it, but this doesn't go there at all. I think a private entity should decide their own fate, whether they want to or not. And again, I recommend that everybody has a vaccination. I just don't think the state of Georgia should mandate it.
Okay.
Thank you, Madam Chair. Senator, thank you. And just to be clear, so this bill makes it clear that whether it's state government, any kind of authority thereof or department, counties, municipalities, and so forth would be prohibited from any kind of vaccine mandate. It in no way, shape, or form encumbers private sector organizations from doing likewise, correct?
Exactly.
That's my
Yes.
reading of it.
Thank
Thank
you.
you, sir.
Printer online.
Thank you, thank you, Madam Chair. Mr. Chairman, thank you for your service. And I just wanted to clarify one further point that in essence, this is a preemption bill,
A what?
a preemption bill.
I would say, I guess so, yes. And again, let me point out, Representative Bremer,
Drenner.
Carla Brenner. Yeah,
Drenner. Drenner.
Sorry, I've known you forever. I can't get it right though. This also has a 1-year sunset, so we can reevaluate it at that time, or maybe the next session.
All right, that answer your question, Representative Drenner?
Thank you, Madam Chair. It doesn't, he did answer it. I would, like my other colleagues would probably want to follow up, but it added more questions.
Okay, Representative Kelly.
Thank you, Madam Chair, and thank you, Mr. Chairman, for bringing this piece of legislation.
Thank you, sir.
Vaccination is a very personal decision between, individuals and their doctors. I believe, like all healthcare should be. It should be a very, personal, deliberate conversation. Based on that, with me and members of my family, we got our vaccine. We thought it was important enough to do that. I've encouraged my friends to have that conversation with their doctor, and if their doctor recommended to get it. But one of the most foundational pieces of our representative government is the ability to show up and petition your elected officials. And so I have real concerns if we were to see counties or municipalities or courthouses across the state to only allow individuals to enter those facilities with a vaccine passport, that would exclude some citizens from being able to participate in their government, from being able to go to the courthouse and check the deed records, to walk in their tax office to pay their taxes, or simply just to attend the city council meeting in person. And so that's why I appreciate this so much, is because it's going to give an opportunity to make sure that no citizens are banned access to their government. And we need to remember that every, government that exists from city council to Washington belongs to the citizens of the state. And I think it's very important that we don't discriminate against those who've chosen against getting the vaccine based on the conversations with their doctor. So thank you for this.
Thank you.
I have a question for you, Representative Kelly. Since your babies have 4 paws, what did you do about vaccinating them?
For COVID?
I'm being funny.
Oh.
Jeez. Your fur babies,
That's right.
which each weigh about 90 pounds apiece by now. So
Yes, ma'am.
like that. Well, we're not very humorous today.
No, I'm sorry.
Well, it's all
Just
right.
caught
It's
me
been
having
a
quite consumed.
It's been a long day. Representative, given that note, Representative Beverly, back to being serious.
Thank you, Madam Chair. To my dear friend, Chairman, how you doing?
Thank you, Mr. Reagan.
Yes, sir. I have a couple of comments, but then I have a couple of serious questions, if you don't mind. To my dear friend, the former Whip Kelly, who's deeply engaged in conversation, not listening to me, I would thank you. I'd like to address something he just said, Madam Chair, if you don't mind, and that is, I think the foundational pieces of government is to prevent the tragedy of the commons, which means that one person can do whatever they want, however they want, and that can lead to a tragedy for most of us. And we in the legislative body legislate against that all the time. That means that I can't do whatever I want if it means it can be imminent harm to you. We do that as a general purpose. I think that's a foundational part of government. We have learned over the last couple of years that COVID-19 that we refer to here, SARS-CoV-2, is an airborne aerosol transmitted disease that what I do could immediately impact you, so much so that 30,000 plus Georgians have died. We know that's a fact. And so if we allow for folk to do whatever they want to, which could lead imminently to my death without me knowing, I think that's a tragedy, and it leads to a tragedy to the commons. I think economics will talk about that in a broader sense, and I think we should be cautious. To my dear friend, Chairman, difficult issue. And my question to you is, we now require that schools vaccinate kids. That is a requirement. Certain vaccines you have to have before you go to school. Why? Because many of these kids contract the illness, could be paralyzed, they could die. And we want to prevent that. It seems that this bill only localizes just SARS-CoV-2 against that. But will this impact schools? So from a preemption standpoint, from Representative Drenner down to the school level, will this prevent schools from requiring kids to have a passport that says they've been vaccinated on a condition just for SARS-CoV-2?
It will just for COVID-19 or SARS-2.
Okay. Thank you, Mr. Chair.
You, Representative Beverly. Representative Hutchins, you get one more. Better make it a good one. We're not going to.
I just want to know, is this the first time that Georgia's ever banned a vaccine?
I don't
So are we
know.
making history here?
I don't know that.
I mean,
information.
the passport,
Yeah.
like we were, just like we were talking about earlier, we
Well, I don't-
required for schools. Have we ever had a ban like this before in
I
Georgia?
don't know if we ever had a passport before now. I don't recall that, except just records. Is that a passport? I'm not sure.
My concern is that we're handcuffing Georgia if this gets out of control. And they're just an FYI, not a question. This is a news story from today. A new type of coronavirus variant is a mixture of Omicron and Delta strains. That's today. So my problem is if this goes out of control and we ban things, this is a problem for public health. We can't control it if we're handcuffed.
Thank you.
All right. Representative Newton. One question, and we're starting to go through again. So one question, we're going to.
Certainly. I guess my question was a little follow-up in some of the questions for you earlier was
Sure.
regarding the way Georgia and the state, most states mandate that kids go to school. And we certainly have treated under 18-year-olds differently. So in complying with that mandate to go to school, long proven safe vaccines are one thing, but separately, I guess maybe because of your attention to COVID-19 vaccine, I do know back in October of 2020, there were people who questioned how quickly that vaccine was developed under the previous administration and were reluctant to take it. I think you approach a very wise point to do this, to do it for 1 year. Nobody can require you to show your papers to go in a government building, as Representative Kelly said. So is that why you put the sunset? Because you understand we will have new information I believe the CDC mentioned it was going to be years before we even understand the data we already have.
Yes, sir. That's one reason. And of course, for this great body to look at it next year and see if they want to continue or just let it run out of time. I just, I'm listening and reacting to my constituency like most of us do. And that's what they thought that we needed. And I agree. So thank you for the question.
Thank you.
It's my understanding, and I believe, and our attorney can tell me if I think I'm wrong, in reaction to Representative Hutchins, should something untoward happen with a new strain or so forth, the governor still has emergency powers, right? Okay, to override the current, if this bill passes and becomes law, the governor would have executive order and emergency powers to override the ban.
I think you're correct.
Right, that's like that, okay?
And I'm not going to be here, so I can't get mad or anything.
Oh, if he overrides your, okay. We have a couple more questions before we go for a vote. Representative Bennett.
Thank you, Madam Chair. Mine is just a comment because you just answered my question. So thank you.
And thank you.
The governor would have executive power to do that. Representative Sharper.
One last thing, why are we doing this bill when there is not really a issue or problem right now? Why are we doing this bill now?
Well, maybe because they're not a problem. It'd be a good time to do it for those of us that think we should not mandate the vaccination. And again, I'm reacting to my constituency. Those people up in the mountains.
Okay.
So thank you for that question.
Thank you for that honest answer. There are no more lights. Is anybody in the audience that wants to speak to this bill? Okay, we have one person in the back. Come up and identify yourself. I think this is another House member that's not on the committee. No. Oh, you're going to go to the table? You can stand right there and identify yourself.
Great. Hi, my name is Rebecca Mitchell. I am a House member. I am also a PhD epidemiologist, and I study infectious disease transmission. I want you to be aware when you are casting this vote that if you vote for this, you cannot unring this bell. We have fought so hard in Georgia this year to protect folks who are going to schools, who are going to government agencies, who do not have the choice where they're going in public. When you start down this pathway, you cannot turn it around. I strongly encourage you to consider what benefit there is from banning this requirement in this moment, and what benefit there would be from waiting a year and seeing whether this is something you really want to do. I understand there is a well-funded anti-vaccine movement in this country. I understand they reach out to you. I get the same emails. We are not going to be able to take this back. You are starting a precedent that is really hard to counter. I am begging you, take a moment, put this on the table, go talk to folks at DPH. I understand you want to do something because it will win you primary votes. Please don't make that choice. Please take the time to consider this more deeply with folks who actually know the impact of starting down this pathway. Thank you.
Thank you very much, Representative. Is there questions for the representative? Okay.
Well, I just want to say that I haven't reacted to any groups. I don't know of any groups. I'm sure they're out there, but mine is plain on what I believe and also my constituency.
Else that wants to speak?
Thank you, Madam Chairman. Appreciate the opportunity to speak. My name is Taylor Hawkins, the Director of Advocacy for Frontline Policy Action. We appreciate the chairman bringing this piece of legislation. And I want to make clear that this bill does not prevent anyone from getting a vaccine in the state of Georgia. Make very clear of that. I know that's already been mentioned once, but to reiterate, it does not prevent anyone from getting a vaccine, nor does it denigrate the taking of vaccines anyway. This is not an anti-vaccine bill. This bill is very specifically restricting government from passing from stratifying society into two different levels, those who have taken a specific government sanctioned medical procedure and those who have not taken that specific government sanctioned medical procedure. And the idea that we would allow that in Georgia is abhorrent. And so this is a very good piece of legislation that makes sure that we don't see that either from the state level or from the local level. And as has already been clarified, should something change about the nature of this virus, the governor does have the full ability to override this legislation with his executive order. So that gives you clarification on that point. So we really appreciate the chairman for bringing this legislation. We think this is an excellent bill, and we would ask that you vote do pass. Thank you, Madam Chairman.
Thank you. Anyone else? Okay, what is the pleasure of the committee? Wait a minute, Representative Bennett. Okay, she has a question for you.
Just one question.
Yes, ma'am.
What would be the difference in the already mandated vaccinations that children have to take to go to school versus this one? Immunizations that currently exist for any child to attend a public school. What's the difference between that?
Yes, ma'am. Well, the specific difference with regard to school children is the longevity of the results around all of the testing, around all of the other vaccines that are available. And as I have stated in previous committee hearings, our organization is neither pro nor anti-vaccine. We believe in the medical freedom for people to make those decisions. But specifically with regard to that question, Representative, the testing has not been done. The results are not in on this vaccine. And that's not to denigrate the vaccine. People have the choice to make that choice if they would like to. But when you're talking in terms of the government forcing citizens to take this vaccine before the evidence has come in and before it's clear whether or not on an individual basis it is needed for each person, especially with regard to school children, there's that. And the other point I would make is the lack of risk that is presented to children. The number of children under the age of 18 who have died from COVID without pre-existing comorbidities is below 20 nationwide for the past 2 years. This is not something that presents a significant risk to children, and so from a school perspective, I think that would address those concerns.
Representative Chokas. Two more questions. Oh, you're gonna, okay, Representative Chokas. Okay.
I was going to go.
I think now is the proper time.
Thank you. Okay, thank you, Madam Chair. I would like to move that Senate Bill 345 LC 520104S receive the due pass designation.
Okay, I've got a motion and a second. Is there any further discussion? And just because I sit close to you, Representative Hutchinson, I'm going to let you have the last one.
Last speaker to tell us about the organization he represents. I wasn't familiar with the organization, so I wanted to know about the organization.
Is that okay? Yes, ma'am. Our organization represents a broad variety of parents and families across the board, across our state. Our dedication is to 7 core principles of human dignity, free speech, limited government, and medical freedom is one of those. So yes, ma'am. Does that answer your question?
But you have more conservative leanings.
Our organization tends to, yes, ma'am, but we work on it. We're a nonpartisan issue.
That's all I need to know. Thanks.
Yes, ma'am.
Okay, Representative Sharper, you almost pushed your button at the same time. This is the last one. Make it quick.
Yeah, I just want to go on record as saying that I don't see us having a problem with this issue right now. So I don't see that we need it right now. So I just want to go on the record on that. I think we should just wait and, around that time of next year to actually do something.
I second Representative Sharper.
Okay, like that. So, okay, I guess I'm going to take the last word on this. And I'm not taking a position as chair, which I don't vote on the bills. However, as a nurse, and I've had all 3 vaccines, I've had both types of COVID. And I believe in childhood immunizations. I think the problem with this, and maybe why the chairman is bringing the bill, is because of all the confusion and the misinformation that's been out there. The misinformation from the CDC, the misinformation about if the mask works and then the masks don't work, and all of that. And perhaps concern now that we are in a quieter period of time, and I may be wrong, and the chairman can correct me if I'm wrong, that the possibility, because Representative Hutchins, like you say, there might be another one coming down the pike, that they feel like this is a time, because there's so much misinformation that's gone out or incomplete information that's gone out, that this would be the time to sort of take a step and step back and not allow anybody to mandate that going forth. Am I right, Mr. Chairman, as we have had discussions about why it's now? Yes. And I have to say, the one place where I have real problems with it is now that our healthcare workers have been mandated to have it or lose their jobs. These are the nurses and the doctors who worked in our hospitals with patients before we had a vaccine and put their lives in jeopardy, taking care of patients across this country. And now we're going to tell them that they must or lose their jobs. I just find that just the worst thing that could possibly happen. And I would think that probably many of them probably had a mild case of it and probably have natural immunity, which is a real thing in the medical community, that you can have it. So with that, the one thing that I really take objection to, when those dedicated people worked long hours and put their lives at risk and took care of those that had the illness, and so many of them, that had such complications and demanded such care. So that's the only thing I'm going to say about it. I'm calling the vote. Everyone in the favor of the passage of 345, raise your hand.
Oh my God, no.
Okay. Representative Tankersley?
Yes. Yes.
Okay.
No.
Everyone opposed?
No.
Okay, we've got you, Representative Schofield, on there.
No.
Let's have it and the bill passed. Thank you, Mr. Chairman, and the meeting is adjourned.